Hello guys, in today's session we'll be talking about the policy or the protocol around fall. So this is more of a generalized conversation, but it will always apply to your local hospital or trust or care home. One thing I want you to always do anytime there is a fall is first, don't assume that the individual does not have capacity, because the people that fall most times are the elderly. So you want to assume that they don't have the capacity. Please don't do that. Assume they have their capacity, assume they understand everything, and give them the opportunity to show or prove that they don't have that capacity. And if they don't have that capacity within the care home, I will expect that there is already a document in place that gives right to someone else to speak on their behalf, which talks about the best interest decision if there's an MDT that have taken place on that subject matter. And if that has been done, then there should be a doors in place for that individual, which gives you the opportunity or gives you the right to speak and to create a care plan tailored for such circumstance. So if there's a fall and he or she cannot lack the ability, lack the capacity to respond to questions that you may be asking the person, then these are the steps that you may probably consider. First, if there are doors in place, then if there's a doors in place, that's fantastic. You can begin to develop your conversation from there. If the person is verbal, oh, fantastic, it's straightforward. Do you feel pain here? How did you fall? Was it you lost consciousness? Were you dizzy? Was it a trip? Could it be hunger? Could it be infection? These are the kind of questions you'll probably be asking. But if they don't have the capacity, bulk of the work is not on you. So if it's a setting where the fall was witnessed, oh, fantastic. Whoever witnessed the fall will then have to answer this question. When you've taken this information, you want to give a complete assessment of the individual. While they are still on the floor, you want to confirm that there are no hip fractures. Both legs, when placed side by side, one will be shorter. That tells you straight away that something has gone wrong here. If that happens, don't lift the person from where they are. You are not to do that because you are not experienced enough to lift them rightly, not to create more harm or not to further worsen the situation of the individual. So let's assume that there was a trip and the individual has the ability to stand up immediately. Then the individual stands up immediately. Then if the individual cannot stand up immediately, but you've assessed the person, you've done your risk assessment, and the individual can stand, then you can get a chair closer. Because it's an elderly person, you can get a chair closer and tell the person to move under your guidance, to move the leg, move the arm, confirm that all of those things are in place. Then you can then help support the person in sitting. But while you do this, you must ensure you are already on the call to 111 to tell them this is the current situation. Thank you very much.